Based on the history of the development of the BTKs, definitely we start with Ibrutinib, but we know that the Ibrutinib has some serious, some adverse effects which do not have the others. And more recently, it has been demonstrated that Zanubrutinib has the slightly numerically better efficacy and lower toxicity, better toxicity profile compared to Ibrutinib. So it depends on the reimbursement in your country. So we are in the Czech Republic, so the reimbursement is based on the special request for each patient, so it's not reimbursed generally. So, but we are starting to ask for the Zanubrutinib as the first one, and definitely the Pirtobrutinib is coming, but we do not have enough data outside of the clinical trial, so we will see how the Pirtobrutinib will be used after the covalent BTK failure or inhibitor BTK failure, or if it can replace the covalent BTK inhibitors.